This card should be filled up.
There you
All
go.
right. Here we go. All right.
And you are now host.
Thank you. Well, good evening, everyone, and welcome to a discussion of research into gun violence sponsored by the League of Women Voters of Colorado's Task Force on Gun Violence Prevention. I'm Rianda Osman. This evening, our guest is Leslie Barnard of the Firearm Injury Prevention Initiative. And this evening, Leslie will talk with us about resource dashboard being rolled out by the Office of Gun Violence Prevention. We're recording this session, and the recording will be posted on the League's YouTube channel. Leslie will have time to respond to questions, and I ask that you put the questions in the chat, and we'll address them at the end of her remarks. Before we start, I'd like to remind all of us that the League of Women Voters is a grassroots organization that has worked since 1920 to improve local, state, and federal government and to engage all citizens in the decisions that impact their lives. The Colorado League was founded in 1928. The League neither supports nor opposes candidates or parties, and we do interact with elected leaders at all levels based on our positions on public policy issues. Our positions are formed after member research, study, and consensus. We are passionate advocates, both women and men, who work to influence public policy initiatives. Now, I'm pleased to introduce Leslie Barnard. Leslie is a doctoral candidate in epidemiology at the Colorado School of Public Health. She's part of the Firearm Injury Prevention Initiative, which is currently celebrating its first year of operation. I'll be putting into the chat a link to their first annual report. You should read it and be inspired. Our league supported the legislation that created the Office of Gun Violence Prevention in 2021, and as part of the statutory requirements, the office is required to create and maintain a resource bank as a repository for data, research, and statistical information about gun violence in Colorado. That effort is now underway. And so, Leslie, welcome.
Awesome. Thank you so much for that introduction. If anyone at any point can't hear me, okay, feel free to put it in the chat and I'll try to monitor that as I'm talking. I wanted to start off just describing a little bit more about my personal background that I think puts into context sort of why I'm so passionate about this work, why I love talking to community organizations like this one, that really sort of, while I'm an academic, I also I love people, I love talking to people, and I think that's what really makes the work meaningful. So I grew up actually competitively shooting firearms. The first time I ever came to the state of Colorado was for the Junior Olympics, where I competed for trap and skeet shooting, which is just such a funny fact about myself. But it really sort of, I always loved math. So I loved math, I loved statistics, and I realized at some point that I could use my background and personal experiences with both shooting firearms, but then also I have, unfortunately, as a member of the firearm owning community, been impacted by firearm suicide. And so my love of statistics and people and all of that sort of came to fruition in getting my doctorate in epidemiology, where I focus on firearm suicide prevention. Yeah, so I'm happy to elaborate on that if anyone is curious. But otherwise, I'll just get started on the presentation. And Rianda did a really good job of introducing, I'm sure as you all know, the bill that sort of put the Office of Gun Violence Prevention work out there, that really established and funded this office that I personally think is so important. And I had the pleasure of and honor of working on part of this. So I wanted to talk about two components of the Office of Gun Violence Prevention that I was able to help work on. I just wanted to note that because I'm a student in the Colorado School of Public Health and I work at the Firearm Injury Prevention Initiative, I'm sort of talking about the academic side. This was really a state academic partnership where CDPHE and the Office of Gun Violence Prevention partnered with us to help get this office off the ground. So all of this is from my personal perspective and not necessarily, I can't speak to a lot of the stuff that happened at CDPHE or Office of Gun Violence Prevention. This, again, is just my perspective. So we were tasked with creating a nonpartisan, evidence-based online resource banks for firearm injury prevention in Colorado. As a part of that resource bank, we have the firearm data dashboard that I'll talk about later on, but I wanted to also touch on some of the stuff that we wanted to highlight in this resource bank that I think is also really important. So the reason this resource bank and the Office of Gun Violence Prevention is so important is because firearm harms impact communities differently, different communities across our state, whether it be rural, urban states, different reasons for firearm ownership, all types of different types of communities can experience different types of harms. And so we wanted to get a full range of all of those types of firearm related harms to bring knowledge to folks in Colorado. Oftentimes firearm topics are contentious or politically charged, and so we wanted to try to take as nonpartisan and purely evidence-based approach when we talk about these topics. Oftentimes prevention strategies don't have evidence, or real great evidence at least, to back them up, and so we wanted to make sure all of the things that we put on the resource bank had that evidence-based backing. And then finally, a lot of this research isn't accessible to the public or isn't easily digestible or isn't in one place, or it's behind a firewall of published studies using complex language that sometimes is inaccessible. So we really wanted to create a space for people that's sort of a one-stop shop for all of this work. So in order to create the resource bank, we looked at existing resource banks that exist at the national, state, and local levels, and wanted to see, all right, what is actually out there. If we're going to create the first state Office of Gun Violence Prevention with all of this work, we want to see what can we enhance upon, what can we make better, and what can we sort of research to not reinvent the wheel, sort of a thing. We also did surveys and stakeholders to see and interviews with community stakeholders to see what folks really wanted to see in their own state Office of Gun Violence Prevention. So we created a tiered development plan, including a site map, a web page, and an external library development. And then finally, we wanted to include that data dashboard that we integrated into the website. So this is just a quote from one of the surveys and interviews that we found striking. So just about the lack of information is at odds with the scale of the problem. So really, people want good information, people want evidence-based information, and there's just not a lot out there for folks. So that's where we saw that we could fill this sort of gap with the data dashboard and the resource bank. Again, making sure that everything that's out there is in one place. So surveying the country and the world's literature and putting it into one spot, especially in the context of Colorado. So this is the organization of the resource bank, sort of our sitemap. It's a little bit small. I can send these slides afterwards and have them distributed to the group if that's helpful. But it just sort of outlines exactly what content is actually in that resource bank website. So in the resource bank, we included different web pages and fact sheets. We use subject matter experts, Injury and Violence Prevention Center staff, created all of this content. Leaderships and subject matter experts revised them. Office of Gun Violence Prevention staff and CDPHE leadership then reviewed and approved all of the web pages, fact sheets, and resources that ended up on the data dashboard, or sorry, on the resource bank website. The highlighted web pages that I wanted to just as a full breadth of what is actually out there. These are all the different firearm-related injuries and deaths, and then prevention approaches that correspond with each of them. So we have everything from firearm suicide, which is over half of all firearm deaths, to youth violence, homicide, mass shootings that are obviously on top of mind for a lot of folks. And we include prevention approaches for each of those issues sort of that we listed on the left. So secure firearm storage for firearm suicide, child access prevention laws for youth violence, and sort of explaining exactly what all of those things are, why we think that they're, or why they are evidence-based, what does the literature actually say, and then also putting into context what each of these problems actually look like in our state. So in each of these fact sheets, we highlighted how firearm injuries and deaths impact different populations within our state. What are the options for secure firearm storage? So in our state, what is available? All kinds of impacts, including different laws that currently exist in Colorado, and for example, like extreme risk protection orders. This past year, the number of people who were able to petition for an extreme risk protection order was expanded. So we have all of that information about how the laws are changing in the resource bank as well. We also have an external resource library that includes toolkits or other peer-reviewed literature, which includes, we really did a deep dive to make sure that this was politically neutral within the scope of firearm injury prevention, the most up-to-date, so it had to be from 2015 or sooner, covers multiple perspectives, and avoids representing individuals and groups using stereotypes. So really, again, trying to make things as neutral as possible, but also include as much information that is out there as possible. So these are the website metrics that we have for the resource bank thus far. It was launched in December of 2023. We have over 22,000 views. And this spiked after a formal press release that I'll show later on that happened in February. And the most viewed web page was the data dashboard, followed by Colorado laws and regulations. Okay, so moving on to the actual data dashboard, which I think is actually what you all asked me to talk about tonight. So sorry for that lengthy introduction, but I thought it was important. So the data dashboard, this was my personal, it felt like my baby. I love data. I love making data accessible to people. And I help lead the development of this dashboard. And I'm just so happy when people are interested in it. And so yeah, I'm very happy to be talking about it. But the overarching goal here was to develop a publicly accessible online dashboard with comprehensive data related to firearms that could be accessible by policymakers, different professionals, people in the public, to explore the scope and the magnitude of firearm-related harms in our state. And we wanted the dashboard to be an interactive tool that could be used by a wide array of audiences to explore all of these types of firearm-related harms in Colorado. So something that is important to note is that data on firearms and firearm injuries can be limited, especially at the state level. So we really wanted to do our best to make sure that we were pursuing every data source that was out there, either publicly available, collected by the CDPHE, whether or not we needed to include sort of data use agreements, any of those things. We wanted to do our very best to create an exhaustive list to make sure we had all of that information in one place. And we ended up using Tableau, which is a software that hosts dashboards. It's a really cool interactive tool that's clickable. When you toggle over it, different information can be highlighted. You can include all kinds of explanations about the data. And it's a really interactive tool that you can sort of tailor to exactly what you're looking for. So that's why we ended up going with Tableau. So to start, this is the landing page for the firearm data dashboard. So the top sort of row right there, you'll see that there's different of those blue boxes with different topic areas. We also have on that landing page, so about this dashboard, we have sort of why this dashboard exists, a technical report in that first link that you can go to that goes through all of the different data resources that we used. And it has more explanations about them. And then also we have an email that goes to our whole team that, depending on the question, if it's more resource bank oriented, like about a specific piece of literature that we brought into one of those fact sheets, or if it's about the dashboard, then one of us, the appropriate person, will be able to answer those questions. I wanted to know, as I mentioned, we wanted this to be as accessible as possible. We really care about people being able to use this to the best of their ability. And to ensure that, underneath each of the pages, we included a little blurb that's called About the Data. So it includes who collected the data, where you can access the data if it's publicly available, any important definitions. So like, for example, this one is explains how a mass shooting is defined. And then also any explanatory commas about why we wanted to use an age-adjusted rate in this case, so that we could compare two different populations rates of firearm-related injuries. There's a couple of different heat maps and other figures in the dashboard. As you can see here, I'm hovering over Boulder. You can see in that hover over, you'll have the county name is actually highlighted, the rate, the population, and the number of deaths. I get cut off a little bit in this picture, but all of that is listed when you toggle over specific counties, so that community-based organizations who are really working in a specific geographic location and in our state can get more specific information relevant to them. And then finally, we also at the bottom of each figure included another sort of explanation about what we're seeing, the biggest takeaway that we're seeing in these graphs. So what's the highest rate? What's the lowest rate? Sort of what do we think is happening? So that, again, it just makes the data that much more accessible. Okay, so moving on to the actual data that we included in the dashboard. We wanted to know how Colorado compared to the rest of the United States. And to do that, we use data from the CDC Wonder System, which is a national data collection tool that includes all death certificates from across the United States. It's the Wonder is a amazing CDC acronym that stands for the wide-ranging online data for epidemiologic research, which I think is just the most CDC thing I've ever heard. But this data source has information on number of deaths, population size, and it calculates age-adjusted rates for you. So really easy and really accessible to the public. Again, when you are on this page, if you go down to the About the Data, you can click the link straight to it, and it'll take you so that you can crunch more updated numbers or do another sub-analysis if that's what you want. So to display how Colorado compares to the US, and this, again, at the top, you'll see we're highlighted the Colorado in context. That's what we called this portion of the dashboard. And we included information about how Colorado compares to the rest of the United States. So that first section right here, Colorado has a higher rate of firearm deaths compared to the US. It has a lower rate of firearm homicides, but a higher rate of firearm suicides and the same rate of mass shootings. So here we're hoping that people can take away that actually in Colorado, the reason we're seeing such high rates of firearm deaths compared to the US is attributable to suicide deaths. And we have the breakdown of those age-adjusted rates so that folks can know the actual numbers that they're looking at in this table right below. Next, we wanted to do a deep dive into firearm mortality in Colorado. So here we use the Colorado Violent Death Reporting System, which is a CDC-sponsored data collection instrument and tool that enables states to do enhanced surveillance of violent deaths. So in that a violent death, any firearm death, regardless of the intent, is noted as a violent death. So all firearm deaths in Colorado will have enhanced reporting in the Colorado Violent Death Reporting System. So here, again, at that top bar, you'll see that we've moved now over to firearm mortality. So our next topic, we moved from Colorado in context to firearm mortality to do our deeper dive into that. We have data included here since 2006. And I have a little video that shows, it goes straight through the dashboard. So you can see information about the filters that we have. We have the type of firearm death that you can filter by on the left that I'll pull down there. And then you can also select a specific county if you want to look at numbers that are specific to your county. And then we have some explanation about the trends that we're seeing, a heat map of firearm deaths, demographic information about who we're seeing that are dying by firearms in Colorado, both by age, marital status, race, sex, and veteran status. So important risk factors for a host of different types of firearm deaths. Again, different explanations that we have underneath each of the graphs, and then a large about the data. So what are we classifying as a suicide death, for example, or how do we determine what is intentional or versus unintentional? What sort of data sources does the violent death reporting system use that makes it more of an enhanced data system instead of just the death certificates? So all of that information is there in that about the data, in addition to additional links to CDPHE for specific information on firearm suicides or homicide deaths. Okay, next, a very politically charged topic, I would say, is mass shootings. What we know about mass shootings is that they're extraordinarily rare. However, Colorado in particular has had a number of very high-profile mass shooting events, which makes folks especially worried about this happening in their own communities. So we wanted to make sure that we heard that a lot in those interviews that we did when we wanted to know what type of information that people wanted. So we wanted to dedicate a whole page to this. To get data on mass shootings in Colorado, it can be somewhat complicated. There's no standard definition of mass shootings across the United States, across public health, across epidemiologists. There's no consensus about what we should define a mass shooting as. So we used the most wide-ranging definition. So here, the Gun Violence Archive defines a mass shooting as an incident where 4 or more people are injured or killed in a single event using a firearm, not including the shooter. So no one has to die in a mass shooting in Colorado or in the Gun Violence Archive for it to be classified as a mass shooting. If 4 people are injured with a firearm in one location, then that's considered a mass shooting. So the widest breadth of definition. So again, we dedicate a whole page to our mass shootings data. Again, we have explanations about what we're classifying a mass shooting as. We also have color-coded injured and killed. Oh, I forgot to note that we did include closed captioning for all of the data dashboard components for e-readers so that those who are visually impaired can also access this information. And we used colorblind friendly colors so that those who are colorblind can see exactly the delineations that we're trying to highlight. So here we include the trends, so that the numbers of mass shootings that have occurred since 2014, including, so that's that green line that you'll see. And then we also have the stacked bars of the numbers that are injured and killed. So in recent years, we've seen a higher number of those injured and killed and a higher number of mass shootings overall, which is consistent with what we see nationally. Okay, so we also wanted to include information on policies that are currently in place in Colorado related to firearms. When we were developing this dashboard in late 2022, the only policy in Colorado that had regularly collected information about in terms of the evaluation of that policy was extreme risk protection orders. We are doing work. So our group right now is collecting information on the lost and stolen firearms policy that says if your firearm is lost or stolen, you have to report it. and if it's not, and then it's used in a crime, you can then be you can have legal consequences as a result of that. And then also the safe firearm storage policy that requires folks to store their firearms safely. So we're currently collecting data on that, but we didn't have it accessible when we actually launched the dashboard. We did have information on extremist protection orders. Our group at the Firearm Injury Prevention Initiative collects information on all petitioners and respondents in all URPO cases across Colorado. So luckily we had that information to be able to display. So we were able to collect that information from the Colorado Court's public access terminal. So once we have all of the case numbers from the judiciary, we're able to then plug in all of those case numbers, download all the data, and then we have a small but mighty army of students who help us pull all of that data from the individual case records so that we can summarize it in this way. So it's a lot of work that goes into these types of evaluations, but it's really important so that we can understand beyond just the passage of a law, how is it actually impacting the public. So again, we're moving on from mass shootings over to our extreme risk protection orders. So we have overall just how the law is implemented. I think I have a video. Yeah, I have a video here, which I think is a better explanation. So we have information about the extreme risk protection order laws in Colorado. We have that same filtering system. So you can choose on the left a specific county, or you can choose a specific date, and the data on the rest of the page will sort of filter by whatever filter that you choose. Excuse me, I'm just going to cough for a second. Oh, excuse me. So you can choose dates or a specific county to filter by. All of that data will then be filtered. And then we have information about another heat map about where petitions are actually being filed in Colorado. And our group has done some work around Second Amendment sanctuary counties, looking at how these URPO laws are being implemented or not. We also have information about who files URPOs, why they're denied, why they're approved, why they're filed, and then information on respondent race and gender. And then finally, again, about this data that sort of shows exactly how we're collecting and collating all of this information. Okay, and then finally, we wanted to get information on the prevalence of firearms that are in our state. There isn't good information out there about how many firearms actually exist in Colorado. There's no official sort of ledger that collects that information. So we wanted to see, is there a way that we can estimate that? So the first way we figured out how to do this is looking at firearm sales data in Colorado. So this is from the Colorado Bureau of Investigation InstaCheck statistics. So all federal firearm licensures have to perform background checks before they transfer or sell a firearm as required by law. And that person who is purchasing or being transferred the firearm has to pass the background check. So they have publicly available information about the approvals and denials from that background check system. And so we collected all of that information and put it in our firearm sales data tab. So we have data since 2012, so 10 years of data. Noting that I think this is really interesting. In 2020, there's this huge surge in purchasing of firearms, which was well documented across the United States. And so we wanted to note that this was not irregular to see this big jump that happened in 2020. But you can see the sheer number of approvals and denials for the sales and transfers of firearms in Colorado each year. And then we also expanded this to include the reasons why background checks were denied, including assaults, charges related to dangerous drugs, burglary, larceny, all kinds of reasons why background checks are failed in the sale or transfer of a firearm. Okay, and then finally, to enhance our data about firearm prevalence, we wanted to look at firearm access and storage among households in Colorado. And the way we did this was using the behavioral risk factor surveillance system, which is, again, a CDC-sponsored survey that collects data across all 50 states. Each state is able to add their own additional questions to the end of this survey. The survey is about 20 minutes, and it asks questions about your last dental cleaning, your last health checkup, if you felt physically healthy in the last month, a host of behavioral and health-related questions. And in 2020, Colorado, CDPHE and the state of Colorado added questions about firearm ownership and firearm storage to this survey. And before that, they hadn't been asked since 2004. So this is new data and really exciting data. I actually use this data for my dissertation. So it's a fun data set for me to be able to work with. But importantly, we wanted to know how many Colorados have firearms in or around their homes, which, according to Breakfast, was about 37%. And then we also wanted to know how those firearms are being stored. As we know, safe storage is a way to reduce firearm injuries. So we wanted to know, of the 40% approximately of Coloradans that have firearms in their homes, how many of them are storing them unlocked and loaded. So I just highlighting, sort of wrapping this up. This is the first of its kind firearm data dashboard to exist at a state level. It was so exciting for me to be able to build and explore all of these data sets, but then also do as much as we could to highlight where we're missing data, where we want to add data, all those kinds of things. I think it's pretty easily accessible. I like to call myself a bad millennial because I don't really know how to use technology very well. So if I know how to use it, I like to think that it should be at least somewhat accessible to others. And we've also intentionally designed it so that people who are visually impaired or use e-readers or maybe don't access data very often are able to digest it in a way that maybe they wouldn't have if we didn't build this intentionally. The great thing about Tableau and all of these data sources is that there's potential for additional years of data. So we're hoping to, on a yearly basis, update these data sources. I'm working right now to get the next year of data, which is for the most part 2023 data, sometimes 2022 data, depending on vital stats can be a little bit slow. But yeah, definitely able to update this on a yearly basis to keep this up as up to date as possible. So in the future, one important, I think, big gap that we have right now is we don't have any data on morbidity. So we have mortality data, so how many Coloradans are dying of firearms, but we don't actually know how many people are being injured in a non-fatal way. So one way that we're hoping to address this gap is by using EMS data or trauma registry data, or ED and hospitalization data to try to assess how many people are have non-fatal injuries related to firearms in our state. There's also more opportunities for geographic or cluster analysis, particularly with the EMS data, that we can geolocate exactly where ambulances are going to pick folks up with a primary complaint of firearm injuries. And then finally, as I mentioned, we're planning on adding additional years to track trends. I mentioned that there was an official press release in February. This was like the most exciting thing for me, that CPR covered the data dashboard. As I said, this is my little baby. And so seeing other people interested in it was just so exciting. In addition to other strategies and news outlets that covered not only the data dashboard, but also the resource bank to hopefully get this data out to as many people as possible. I personally love, as I mentioned, talking with people. I love talking about this data. I'm really passionate about it. So we'll continue to talk to groups like you all. Happy to talk additionally. If anyone, obviously we'll have questions at the end, but yeah, any or other organizations, if you know of, that would be interested in this data, I'm more than happy to sort of talk about it. Yeah. Other states and territories are taking note of what we're doing in Colorado, which is really, really exciting, because we can be a leader to sort of help them sort of figure out how did we sort of develop this dashboard, and how did we develop this resource bank, and how can others do this for their states. And then finally, the White House Office of Gun Violence Prevention that was established by President Biden um, has been talking with our group particularly about the data dashboard. So that's really exciting that national leaders are really paying attention to Colorado and paying attention to the results of this legislation and the work that we're doing. So super exciting stuff. This QR code is actually to the dashboard website. So if anyone wants to scan it, feel free to. And then that's my email if anyone has questions. There's also that email on the landing page of the dashboard. So you can feel free to email that or me directly, whatever is easiest for you. And I'd be more than happy to take questions now and continue the conversation.
Okay, thank you. Let's see, we have one question in the chat right now from Virginia Mack, who says, it's excellent to have this data. Has your group speculated on the types of barriers that exist for new petitioner groups with regard to filing ERPOs, specifically mental health professionals and healthcare professionals?
Yeah, this is a great question. So I guess I'll just say a little background. I'm not sure if everyone knows the nuances of the ERPO law, but when it was passed in 2020, the petitioner groups that were allowed were law enforcement and family members or friends who lived with a petitioner. So they had to like reside with them or share a child with them, have some sort of familial relationship with them. This new petitioner group that started, I believe, in the middle of 2023. So they've almost been eligible for a year, included district attorneys, educators, so like high school or college level, any level of educator is able to petition for an ERPO. Mental health care providers, social workers, physical health care providers, and I think that encompasses the whole list. So we've been tracking this new group. I believe to date we've had 2 mental health care providers petition for ERPOs, and that is it. We have about 150 ERPO petitions each year, so likely a huge underrepresentation when we're talking about potential need of ERPOs. Our group in particular has not done any studies among Coloradans in particular, but there are other groups out of University of Washington and Johns Hopkins that have looked at mental health care providers and social workers, and some of the barriers that have been noted in particular are breach of HIPAA, and breach of trust with clients, which is a huge barrier, and I don't think it's fully been thought through. I think it's the realities of it is a lot more complicated than what we as researchers or folks who are passing these laws maybe realize. In addition, when we're thinking about law enforcement groups versus some of these other groups, the law enforcement groups will be paid as part of their job to show up in court and sort of defend this ERPO petition that they filed, versus medical providers, mental health providers, everyone else who is petitioning. It's sort of on their own to do it. So a huge, huge barrier, I would say, in addition to navigating a legal system that they're not familiar with, whereas law enforcement are likely more knowledgeable. There's also cultural differences across different counties within Colorado that some law enforcement may be more likely to accept a transfer of some of these ERPOs. So like if they have a referral from a family and they say, would you like me to do this on your behalf? We hypothesize that might be happening sometimes in some counties, but maybe less likely to happen in other counties, sort of depending on those cultural differences. And also caseload of law enforcement. So that was a really long explanation and sort of roundabout answer. I'm not sure if that fully addressed your question, Virginia. Okay, thumbs up.
Okay, very good. Who has been using the data so far?
That's a good question. I don't think we know exactly who's using the data. So we can do sort of those basic metrics, looking at who is, how many people are accessing the website. Um, I have had a lot of, so to our like OGVP email regarding this, particularly the data dashboard, we've had a couple of community-based organizations reach out with questions. Um, and as I mentioned, other states who are interested in sort of doing something similar in their region reach out, and that were interested in for those reasons. But it's hard to tell until folks start maybe like referencing it or
Mhm.
letting us know that they're using it. It's really hard to tell who's actually using it. Yeah.
Okay. You said that when you were started, in your needs assessment, you looked at existing databases to see what was out there. What were those databases, and how useful were they?
Yeah. So some of those databases were the ones that I mentioned that we're hoping to expand to look at the morbidity statistics. Um, EMS data, ED data, hospitalization data. Part of the reason why we didn't use them to start off is because they are not collected by a public institution and may require additional payments to get access to them. And so we didn't want those things to hold up the publishing of what we felt like was a relatively comprehensive um, dashboard, but we do hope to include those in the future. So yeah, as I mentioned, EMS data, trauma registry data, ED data, hospitalization data. Yeah.
Okay. Um, let's see. Any more questions from people out there? Yes. Here we go. All right. This is from John Roger Dodds. I'm trying to think through a presentation on places for the warning signs suggesting ERPO petition. And I'm thinking of A, troubled juveniles, B, spousal abuse, C, depressed elders, re-suicide. Where else should we be looking?
In terms of who is eligible for a petition.
No, in terms of educating the petitioner population on where they might be looking for preliminary indications of potential violence that would suggest they might look for advice on ERPO petition. What are the populations where what are the places where community members might see potential violence that they could consult on an ERPO petition?
That's a good question. So I mean, the law stipulates that folks who are eligible petitioners have to be threatening violence to themselves, to others, or to both. So we've seen I think it's about a third of ERPO petitions are to prevent suicide. And it could be, ERPO petitions can be filed to remove someone's firearms or to prevent someone from purchasing firearms. So it will act sort of a both and. So someone doesn't have to have firearms in their possession, but if they're saying, I'm going to harm myself using a firearm, I'm going to go and buy one, that's a situation where an ERPO can be applied, and we've seen that applied in Colorado. I'm not sure. It's hard to tell if the number of ERPOs that are being filed in Colorado is sort of meeting this number needed to treat sort of threshold, which basically says if you have X number of people that are eligible for a petition, you need to have at least Y number of petitions to save one life. We don't know what the X we don't know what that denominator is of how many people are threatening violence to themselves or others using a firearm. So it's really hard to tell sort of where to look for this tool being an underutilized resource. Yeah, I'm not sure if that answers your question 100%, but I think that there's a lot of questions that we still don't know about ERPO petitions, in terms of how they are being used inconsistently across counties, but then also where public support isn't fully there for their use. I'm sure some of you remember some of the public backlash once that ERPO law was actually passed. There was a lot of folks um, who were concerned about due process in the ERPO law. So we're trying to track that as much as possible to show that this is actually following due process. Yeah, that's not a great answer to your question, but I hope that sheds a little bit of light on there.
Yes, thank you, Leslie.
Mhm.
Okay,
Can I ask a question directly?
have
Yeah.
at it, Catherine.
Catherine? Yeah. I don't know if you can see me. There you go. Can you see me?
I can't see you, but I can hear you great.
Okay. Yeah. No, I just had a question because I
Oh,
also
there you are.
follow the Johns Hopkins Center for Gun Violence Prevention.
Mhm.
And I also was a gun violence prevention activist in Maryland. So I can compare the situation in Colorado with what I saw there. And on that, just a quick question. Are you with the Gun Violence Prevention Office here in Colorado?
I'm with the Firearm Injury Prevention Initiative at the University of Colorado. So the Office of Gun Violence Prevention is sort of an offshoot of CDPHE almost. So we are like subcontracted through the Office of Gun Violence Prevention, but I'm not officially part of the Office of Gun Violence Prevention, if that makes sense.
You're supplying a lot of data for
Yes.
them.
Mhm.
This might be something that's more directed to the Office of Gun Violence Prevention. But one thing I thought was very effective with the Johns Hopkins Center is one of their lead researchers is herself a gun owner.
Mhm.
And they have a video presentation on the Johns Hopkins site
Mhm.
of her sitting down and being interviewed about safe gun storage. And so she has 3 handguns laid out in front of her, and
Mhm.
she explains the mechanism for safe storage for each one of them.
Mhm.
So the difference between Maryland and Colorado, I see, is that, Colorado, there really is this strong tradition of gun ownership. It's really widespread, especially on the Western slope. I
Mhm.
thought it was very effective to have somebody who was a public health professional be so knowledgeable and be able
Mhm.
to talk about these technical aspects of safe gun storage.
Mhm.
That may not be what you are responsible for at all. That might be something that the Gun Violence Prevention Office might want to put out. I just thought that was great to have
Mhm.
somebody because what they have found is people who are really fixated on their gun ownership, they tend to be dismissive of public health information. They're
Mhm.
far more likely to listen to somebody who has experience with firearms. So a police officer or a military veteran, that kind of thing, then they'll tend to listen more. And I thought that was very effective, just to mention this.
Yes,
Because there are so
absolutely.
many gun owners in Colorado, right?
Yeah, I actually think I know the researcher that you're talking about from Johns Hopkins. It was absolutely fantastic. No, I think that's a great point, and I think at FIPI and at the Office of Gun Violence Prevention, the intent is to be as nonpartisan and keep things as factual as possible. So a similar intent in that meeting people where they're at. It's not an advocacy organization, FIPI or the Office of Gun Violence Prevention. It's a data-driven organization, and it's a data-driven initiative, which I think is important. I also think, to your point, you know, uh, and I think that public health is sort of guilty of this in the past, is we can create all types of intervention, but if the population that we're intended to reach is not in the conversation, it's useless. No, that's not going to create any kind of behavior change if we're not reaching out to the populations that we're intending to impact. And so, particularly in Colorado and the Firearm Injury Prevention Initiative, we lead something called the Colorado Firearm Safety Coalition. That is a coalition of firearm owners that, in particular, does work around safe storage. It's I would say, a little more like grassroots than the Johns Hopkins website that you're talking about. But the intent is very similar, to sort of go hand in hand with community organizations and really focus on trusted messengers, those key folks who are people in the community, who people who own firearms, whether it's for protection, whether it's for hunting, trust. Like, they're not going to trust someone like me. I've already told you my background. I shot firearms competitively. Like, I know all the safety rules. I can probably outshoot a lot of folks, but it's hard for me to be an insider in that group still. And so definitely working with people to sort of come to this common agreed upon meeting space, I think, is really key. And I think that's something that we're always going to have to keep working at. And we can definitely look to organizations like Johns Hopkins that are doing that work and use that as a model and try to mirror that here in our own communities, for sure.
Well, I'm glad to hear of those grassroots efforts. That's good. And
Other
thank you.
questions?
Thank you
Absolutely. Yeah.
for your work. I mean, it's great. It's really impressive.
Any other questions? We have in the chat a request for the website address.
Oh, yeah. Let me grab that.
So if you could do that. And we'll be asking you also if we could have copies of your slides.
Mm-hmm.
All right.
Okay,
And
that's the resource bank. And then this is the data dashboard.
okay. Thank you.
Absolutely.
Well, then I think that we can call this a great success. Thank you very much. That was a very nice tour of a very nice tool. Thank you.
Yeah, absolutely.
Right.
Anytime. And if anyone wants to reach out, I'm more than happy to chat about this further. Or if you know other organizations that would be interested in a presentation like this, it's where my passions lie. So I'm happy to do that.
Excellent. Excellent. Well, we will be posting the recording and your slides. And if there's anything that we can do for you, let us know.
Awesome.
All right. Good night.
Have a good
Thank you,
one.
everyone.